Hello, everybody. Welcome to, I believe, episode 14 of the Mental Health Truth Podcast. I am your host, Marcus, but you can call me Truth. So before we had a 3-part series. We started with, it was racial and ethnic differences in mental health. Then we went to the gender differences, and then we went to the LGBTQ and mental health. So now we move on to another series. It's just a 2-part series. It could be one episode, but I feel like it would be way too long. Probably like an hour and a half to 2 hours. So I'm just gonna break it down into 2 parts. So this one's basically towards more of the therapist, counseling, counselor type of people. And I was thinking about having like your own private practice, and why does it cost so much? Why do people charge so much? So there's many people that don't get the services. As we mentioned before, one of the biggest problems was cost. So I wanted to see like how much it usually costs for a session and like the reasons behind it. Because it wouldn't make, there's some places that have it really cheap, or they have like a sliding scale, meaning that depending on how much you can pay, right, then the price of the session would be tailored towards that. So if you had more money, you would have to pay more, but if you didn't have a lot, you wouldn't have to pay more, just to make sure that everybody gets the help that they need. But some people just have a fixed rate, and they're usually way too high for people to even like spend or even like go to therapy or go to seek help. So we're going to look at it. Originally it was about 6 to 7 articles, but this time we're going to short it to 3. So 3 per part in the series. So for this part, we are going to look at the cost of therapy and each therapy. So like individual, couples, marriage and family, etc. And then we're going to see how much does it really cost to start up a private practice. Basically the cheapest way to start up. And then the next part we'll look at a more kind of neutral kind of way, like a natural way, and not finding like the cheapest way possible. And then the last part would be insurance, because insurance is a important part of people getting treatment. With insurance, it's going to cost way less than someone that doesn't have insurance. So with that being said, let's get started with these articles. So the first one, how much does therapy cost? So it says therapist rates average $90 per hour, with most spending between $60 and $120 per session. If you live somewhere like New York or Los Angeles, standard rates for health providers can jump up to $250 per hour. Now, who would have that much? Who would have $250 to go to therapy sessions? Now, if you didn't know, the average session rate would be 12 to 16 sessions. So let's calculate this really quick. Calculator. All right, we have 250 times 12. We have $3,000. So let's do 16. 250 times 16. We have 4,000. So $3,000 to $4,000 per each time you go to therapy. And usually the treatment lasts about a year. So think of paying $3,000 to $4,000 every year for these kind of services. Now, if you have it, then by all means go ahead, but not a lot of people have that. So there's a difference. Not a lot of people would pay. I even asked on my Instagram page, how much would you be willing to pay for therapy sessions per hour? Most people said between $20 to $50. But here we have $250 per hour. The average is being $90 per hour. So it seems like most people wouldn't be able to pay for it. But let's keep going. So, does insurance cover therapy? So, across the United States, specific laws such as the Mental Health Parity Law require certain health insurance plans to cover therapy for mental health issues. Some insurers are generous with their mental health coverage, while many others require you to pay most of it out of pocket. Those who have purchased insurance through the Affordable Health Care Act or the Affordable Care Act have access to some level of mental health care. Those who obtain insurance coverage through their employers are also often covered. Some therapists participate in insurance networks, so if you typically pay a $50 copay to see your doctor, the cost to see a psychologist will not be any higher. To better understand what you need to pay individually, you should inquire about your current deductibles, copays, and coinsurance, as well as any out-of-pocket cost. So, for the most part, insurance does cover any mental health care or treatment that you seek. But later on, when we get to the last article, you'll see a lot of people not necessarily insured, or that they are underinsured. But we'll get to that when we get to that. So the cost of therapy with insurance would be $20 to $50, and without insurance it would be $50 to $250. That's such a huge difference when you take into account the amount of people that are underinsured, the amount of people that don't have insurance as well, and the people that just simply don't have enough money. It can be a lot, and you could see why cost would be the biggest issue. Now, the different types of therapy. So for individual therapy, the average cost is $70 to $150. Couples therapy, $70 to $250. Marriage counseling, $70 to $250. Group therapy, $30 to $80. Depression therapy, $100 to $200. Grief counseling, $70 to $150. Sex therapy, $100 to $200. Anger management, $50 to $150. Cognitive behavioral therapy, $100 to $200. And art therapy, free to $100. So as you can see, most of them will still be around the hundreds area, even though most people said they would pay between $20 to $50. You can see none of these prices really fit $20 to $50. Most people would charge even more. But you may be thinking right now, like, oh, it doesn't make sense. Why do people charge so much? Well, when we get to the second part of this series, we'll go into that. Why does it cost so much? Why do people charge so much? Why can't they charge less? It all has to do with, it is a business after all, and you have to keep it running, right? So you need enough funds to keep it running. People can't necessarily see a whole bunch of people every day. So, or else they'll get burned out. And you don't necessarily want to get burned out. You want to have the right number of people to see, the right prices to charge, so you have enough to sustain a living for yourself, enough to pay for any cost in your business. So think of marketing, renting an office, because you need to have a place to work. Some people will do it in their homes, which is fine since the cost is very low, maybe even nothing. But you also have the dangers of working at home, because you're basically inviting people that you don't know into your house. You don't know what's going to happen. Someone may have anger issues and they may take it out on you, and now you put yourself in danger. You put other people in that household in danger. So you don't really know what's going to go on. That's just a little bit based on that. So we've seen the prices. We have seen the prices so far. Now it's time to see how much would it cost to have a private practice. So this one says cost for starting a counseling practice in 2020. So basically, counseling practice would be the same as therapy, basically. So it's pretty much the same. So here's what you need. So the first, you need a place to practice, right? So some people, like I said, they do it at home, or they will get their own office. So what this article recommends, to have the minimal amount of cost, they have this thing called subletting. So when I hear the word subletting, I just think of the Airbnb, where you rent a place for the weekend. Let's say you're throwing a party or having an event and you need a space to have. So you kind of rent someone's space. It's mainly like that. So instead of having an office, instead of you renting for an office, you're essentially renting the office space for the time that you need it. So let's say if you're working on Monday, so you're going to rent for that space for that day, instead of just having it rented for the whole month and doing those kind of payments. You're essentially just renting as you go along. So it's much cheaper. So they say many therapists can get started for under $100 a month if they research and negotiate well. That number can vary based upon your area. Subletting means no need for decor, couches, etc. So essentially, it's a place that's already set. It's not think of it like someone rented a place in your house. You already have the furniture and everything. It's not an empty office that you have to get all this stuff for and pay all this money for. So that's essentially what it means. So it's you already have all this space. You just have to take care of the space and whatnot. So some will even let you graduate up, meaning you only start paying for the space when you begin to get clients. So let's say if you're not getting anything right now, but you have a place already locked up for you to do your work, right? You don't necessarily need your own office, especially when you're just beginning. That's why a lot of people do it from their house when they just start, because they don't necessarily have the funds. They may not want to take out loans, etc. So this says the investment would be $200 a month. So far we have 200 on our calculator. Now the second one, business licensing fees. Depending on your location, you may need a business license. Contact your city to find out. The average business license is under 100, and not all cities require them. So let's say this city requires them, right? So we add another 100. So we're at 300, but we're still at 200 per month. This is just to start up. So we're at the total 300 right now. The next thing you need, an EIN and NPI number. These actually aren't even required if you're running a cash pay practice, but they won't hurt. They're both free, can be grabbed online in a few minutes, and are needed if you're going to provide CMS 1500 forms or super bills for your clients to get reimbursed, or if you're going to work directly with insurance companies. Now, this investment is free, so there's no need to worry about it. You might as well get it since it is free. There's nothing, there's no risk for doing so. Next, you'll need liability insurance. Whether you're in private practice or doing agency work, many insurance plans allow for a certain number of clinical hours in private practice without increasing your annual fee. You can get general liability insurance on top of your clinical liability insurance. Let's see. So it's based on if you feel like that is right for you. So the investment would be $450 annually. So this is a year. So we got to do some calculations. 450 divided by 12. We get $37.5. $37.5 a month. So we're at $237.5 a month. Next, you'll need clinical forms. You need to get your informed consent and policies together. Many professional organizations like the California Association of Marriage and Family Therapists make templates available for their membership. Some will even review your paperwork as a part of your annual membership. If you develop an online practice process, you can have clients sign online, so you may not even have any initial printing cost. So they say the investment is $0. So let's see. So let's look up an association and see how much would the membership cost per year. I'm pretty sure it's around $175. Could be wrong. I think that's how much membership that I pay for a year, $175. Maybe $200, but it shouldn't be any more than that. So the professional membership would be $189. And okay. So 189. Well, 185, we'll say 190. 90 divided by 12. That is 15. We'll round up to $16. So add another $16 per month. That would be around $255. We'll say $255 per month. Number 6, a business line. There are call forwarding services that allow you to get a number for your clinical practice and have that forward to your mobile phone. Avoid having to carry 2 phones around if you can, and avoid that extra cost of an extra cell phone. Some services allow you to send calls direct to voicemail outside of business hours, so you don't have to worry about your personal mobile ringing constantly. Many therapists started out using Google Voice to get a free line. There are some gray areas in regards to using this service. Worst case, you can get a service that is explicitly HIPAA compliant for under $10 a month. So the monthly fee would be $10 plus the cost of your current cell phone. So we'll say $265. Now number 7, a secure email account. You can use G Suite to get started with a business-based email that is HIPAA compliant for $50 a year. So if we divide 50 by 12, we get $4.2. So we'll just round to 5 and say $270 right now. A website, I have one. It's not that expensive, especially for a domain and like the name and everything else that goes with it. So your investment would be $16 a month. So far we're at $285 a month. Now we have practice management system. Many people don't believe you need to start with the practice management system. Let's see. So the cost for this would be $40 a month. And then let's see. So we have a printer, we have computer access, we have internet access, business cards, professional associations, and trainings. So you would have around $450 per month with your initial investment of $1,600. So they said one weekly client at $150 and you're breaking even. So they're saying $150 per month. Well, not per month, per session. And typically you meet once per week. Now, even then, again, no one would really have that much money. Now, maybe there are people that definitely have that, but it's not necessarily tailored towards like the lower populations that don't necessarily have enough money for those type of services. Especially for something, let's say, that's not 100% guaranteed. Like, again, the average time that therapy works is a year. So eventually you're going to have to go again and again and again if you want to be consistent. Now we will go to the last and final one about the insurance. So it costs $20 to $50 with insurance. So let's see how many people do have insurance. So this was a survey, and these were the highlights, but we'll go more into detail. So it says today, 45% of U.S. adults ages 19 to 64 are inadequately insured, nearly the same as 2010. More people who have coverage are underinsured now than in 2010, with the greatest increase occurring among those in employer plans. People who are underinsured or spend any time uninsured report cost-related problems getting care and difficulty paying medical bills at higher rates than with those with continuous adequate coverage. Federal and state government could enact policies to extend ACAs, so the American Counseling Associations, health coverage gains and improve the cost protection provided by individual market and employer plans. So who is underinsured? So we consider people who are insured all year to be uninsured if their out-of-pocket cost, excluding premiums over the prior 12 months, are equal to 10% or more of household income, or if their out-of-pocket cost, excluding premiums over the prior 12 months, are equal to 5% or more of household income for individuals living under 200% of the federal poverty line. So $24,000 for an individual or $49,000 for a family of 4. Or their deductible constitutes 5% or more of household income. So that is what the definition we're going with for underinsured. So we have 55% of people that are insured all year, with 23% of people insured all year but are underinsured. We have 12% of people we have 10% of people who are insured now but have a coverage gap. And we have 12% that are uninsured right now. So we have 42% of people having individual coverage that is underinsured, with 28% being the employer provided coverage being underinsured. And those numbers have been, the employer provided coverage has been increasing. So more people are getting coverage, but they're not enough to help with the cost. Why are insured Americans spending so much of their income on healthcare costs? Although the Affordable Care Act's reforms to the individual market have provided consumers with greater protection against healthcare costs, many moderate income Americans have not seen gains. The ACA's Essential Health Benefits Package, cost sharing reductions for lower income families, and out of pocket cost limits have helped make healthcare more affordable for millions of Americans. But while the cost sharing reductions have been particularly important in lowering deductibles and co-payments for people with incomes under 250% of the poverty level, which is about $62,000 for a family of 4, about half of the people who purchase marketplace plans, and all of those buying plans directly from insurance companies do not have them. The bans against insurers excluding people from coverage because of a pre-existing condition and rating based on health status have meant that individuals with greater health needs and thus higher costs are now able to get health insurance in the individual market. Not surprisingly, the survey data showed that people with individual market coverage are somewhat more likely to have health problems than they were in 2010, which means they also have higher costs. While plans in the employer market historically have provided greater cost protection than plans in the individual market, businesses have tried to hold down premium growth by asking healthcare workers, or by asking workers in general, to shoulder an increasing share of health costs, particularly in the form of higher deductibles. While the ACA's employer mandate imposed a minimum coverage requirement on large companies, the requirement amounts to just 60% of a typical person's overall cost. This leaves the potential for high plan deductibles and co-payments. Growth in Americans' incomes have not kept pace with growth in healthcare costs. Even when healthcare costs rise more slowly, they can take an increasingly larger bite out of incomes. So it says fewer adults report not getting needed care because of cost, but gains have stalled in recent years. Percent of adults ages 19 to 64 who reported any of the following cost-related problems accessed this in the past year. So we have 35%. And the reasons were they had a medical problem but did not visit doctor or clinic, did not fill a prescription, skipped recommended tests, treatment, or follow-up, did not get needed specialist care. Inadequate coverage is associated with more cost-related problems getting needed care. So 11% of people that did not fill a prescription were insured all year and not underinsured. 10% skipped recommended test, treatment, or follow-up that were insured all year and not underinsured. We have 11% that had a medical problem but did not visit the doctor or clinic, and 50% would be uninsured right now. And did not get needed specialist care is 7%. So it looks like half the people are not visiting their doctors or clinics even though they have a medical problem because they don't have enough money for it. So how can they really go for it? Fewer adults have difficulty paying their medical bills, but the improvement has stalled. So 37% of people have problems paying or are unable to pay medical bills. Contacted by a collection agency for unpaid medical bills, had to change way of life to pay bills. Medical bills / debt being paid off over time. And again, most people, very few people are insured for each of these categories. So around 10 to 15% of people would be insured under these categories. So continuously insured adults, including those uninsured, are more likely to get preventive care. So most people would be insured. So since these are insured adults, since they're insured, most likely they are going to get care, while the people that are underinsured or don't have any insurance wouldn't get care. And that's pretty much the end of that article. As you can see, most people don't get the care or the insurance needed to get the treatments that they would like, which means that most people just go around untreated. People want to help others out, but their rates are a lot higher than what people actually need for the treatment. But so it's like a double standard, right? Like you want to help people, get treatment. If you charge too little, you'll have to see more people and risk getting burnt out. But if you don't charge, if you do charge a lot, you'll see less people, less chance of getting burned out, but you're helping a smaller pool of people. There are people that are willing to pay that because they have it, but there are a lot of people that don't have it, so it's hard for them to really get treatment since they just have a huge problem with the cost. Before, it was like 60 something percent from the last one when we went to the racial and ethnic. Like 60% of people didn't go because of cost. Cost was the highest reason. And now you can see why. It has to do with the cost that people in private practice set as like their per hour cost, because of all the other factors, having to live, having to pay for the office, paying for all these other things. If the time that's not spent working involves like marketing and other things to make sure the business is going at full speed. If you charge less money, that means you have to see more people, which takes more time away from you. Like most healthcare workers tend to take like their work home with them, even though it's not beneficial to do that, because they see somebody, they have like a 5 to 10 minute break to like fill out paperwork, then they're seeing somebody else, and then the same thing happens. Most of the times you don't necessarily get to finish the paperwork that you had, so you eventually have to take it home. Then you have to think, let's say if you have a private practice, you may have people that contact you talking about they want sessions too, and you never really have time to like be on your own and like practice any self-care. So you just get burned out a lot quicker. And that's why the burnout rate for this profession is so high, because like it's such an issue, right? The cost, how many people you get to see, to help them as much as possible. That's maybe why some people have bad experiences with these treatments, because maybe a lot of people are burned out and they can't help you as best as they normally can do. And it's like no one really looks into each one of these factors. It's really hard to determine what's the best solution. But we will get more towards that in the next part of the 2-part series for the therapy and counseling services. So in the next part, we'll be discussing a more modern way of like running a private practice, like the cost of having our own office, essentially like myths about running a practice. You know, like you basically, they have like, oh, you shouldn't charge little money because it's based on what you feel like your experience is. You know, you may feel like people wouldn't get care, and this is not necessarily true. Even people with not a lot of money will receive care, and that not charging very little will just do more damage than good. So we'll go over that part. There's also 2 more that I want to share. And I'll also go over my whole plan, like what I would charge, my schedule, and everything. And you could see what my thought process around that was. So if that sounds interesting, I will see you on the next episode. And as always, take care, and Truth signing out. Goodbye, everybody.